So let's briefly go to the public, and then I want to really deal with the medical community just on a small number of issues. So the first thing is you have a state that's had this for 3 years. Your problem of living here is you do not hear the vitriolic attacks on what goes on in Massachusetts on other news sources. It's unbelievable. People call me and say, where can I see the patient dying with a hernia because they can't be seen? Where they're just queuing up all through the T. Where are they? I need to send a camera crew up to look at the pain and the suffering that's going on in this state for that. And I heard so-and-so on some news channel unmentioned saying people are about to riot in the state. Do you have a measure of riot index, Professor Blendon? Are they marching on the State House at this moment? So this is where we are in terms of public support. It's not, doesn't look to me like pre-French Revolution. I mean, it kind of looks like we have had some drop off. It's back to the 206 level for this, but this is in terms of keeping or repealing the bill. There is no support in the state really of any significance for repealing it, but the change issues are all around the cost side. So we're going to talk about this in a moment. The change issues are on the public side for this. But here am I back to my Clinton side. So here is real world. For most people in the state, the bill has not impacted, and we'll talk about the medical community in a second, it has not impacted their lives at all. Of those who it's impacted, with the exception of costs, more say better than worse. So it's the complete opposite of what I showed you about the national perception. The national perception is if I think it's going to change, more think it'll be worse. The perception of the state is if it changed, more think it's better. So this is the critical takeaway. For most people in the state, 3 years into here, nothing happened in terms of affecting the care they get. If something did happen, with the exception of costs, more think it actually got better than worse. And that is the most important message to the nation that comes out of here. So there is a problem about the cost, and it's very, very real. Half the state doesn't believe that we can afford this in the future. For that, they're really worried. The other half thinks we can. So the cost issue will be, in my view, a gubernatorial level election issue about what to do about that. Let me talk about the medical community. And first, let me thank the Robert Wood Johnson Foundation and the Blue Cross Blue Shield Foundation of the state, and they deserve enormous credit. The poll in the survey, it appears, comes from their calling me and saying that the criticism of Massachusetts is so extraordinarily negative outside the state, and people are inferring that the care is deteriorating. And you really need physicians' views here, because people are going to say, well, the public really doesn't understand what's really happening. So what is the most important from the survey you'll see from the national argument? We asked what was 2,135 practicing physicians in the state. We asked them about 22 things going on in their own practice. In 21 of the 22, the majority said either there was no change as a result of the law or things got better. And so only on one item was getting worse, more significant than getting better, and that was administrative burden. So many of you will understand this, but the administrative burden really does this. But what was really quite dramatic when we see the table is the things that are being attacked, which is your ability to get an appointment, your time physicians spend with patients, the quality of care provided, your ability to get a referral. In every one of them, overwhelming majority said either nothing changed or it got better. So completely opposite than the national polls I showed you. So what is so powerful is this is living with at least a part of the national debate 3 years later. People are not reporting, in most cases, deteriorating care, problems, forgetting that. It turns out, and I warned the supporters of this, physicians are not immune from the economic problems that we've been having. And so we knew we were going to be surveying people, and it has been a tough time for that. And half the physicians in the survey said that their financial conditions deteriorated over the last 3 years. So my experience is when people tell you that, anything I ask them afterwards, they hate. That's the way national polls go. How's your financial circumstance going? Terrible. How's Obama doing? Terrible. How's the world situation? Terrible. So I said, oh my God, we're going to have this, and they're going to say, look, things are really bad, and blame the damn bill. But they didn't. So 70% of physicians supported the bill. 7% were for repealing it. So 75% wanted to go on. The changes were a little bit different than the public that people wanted. There was more effort on expanding coverage, some on costs, and the third was increasing reimbursement in some of the circumstances. But overwhelming support for this. And my colleagues in medicine thought there was nothing unusual. Physicians in the state like medicine in this state dramatically better than they think medicine is in the rest of the country. So the rest of the country thinks you are living in some sort of deteriorating situation. And you think that this is a heck of a lot better than they're living in terms of medical practice. In terms of the broader concerns, the second thing is we asked them about 20 things about the state. And what was critical is 2 stood up as real warning signs. The physicians clearly realized that there was a cost issue emerging out of this bill, and that just stood right out. And about a third thought that it really had created a real primary care shortfall problem. And so many specialists and all don't see that, but there was about a third. On the positive side, and this came out in 3 places in the survey, physicians basically said, you've eliminated from our lives uninsured patients. In my practice, in the state, 79% said, well, what is the biggest and most successful impact was basically eliminating uninsured patients from our lives. So that is very powerful. So I want to tie this together, and then we'll close and leave time for questions. What is going to be extraordinarily important in the next 2 to 3 months is assessments of people who are respected and professional about what is being discussed and whether or not in your assessment people's lives will be better off and worse off by that. And that's really what they want. What they actually don't want you to do is discuss the elements of the plan with them. And that's what we all love to do. Let me tell you how this actually works. And actually, they don't want to know, and that's how polling people always get shocked all the time. People say to you, I don't exactly know what's in the Social Security Reform bill. It's a terrible idea. And you get used to it. People take impressions away from that, and they want to know whether or not it'd be better or not. And then they're going to really come to Massachusetts. There'll be more mics than physicians trying to interview you. Is it not correct that your life is terrible as a result of this bill, and people are suffering and everything else, and so the Congress just can't go forward with whatever it's talking about because it's going to replicate this. So this is really the critical issue in the last few months.